Scientists criticized the special way Björn Olsen, professor of infectious diseases at the University of Uppsala, criticized in the current edition of the summer narration in Sveriges Radio not only the health department and what he considered to be the lack of measures in the COVID-19 pandemic. He also sees sectarianism at work at the authority. The 61-year-old, who also works as a senior physician at the Uppsala University Clinic, is one of the 22 scientists who, from the start, resisted the country's special path, which had avoided a lockdown in the spring. In the popular program, the doctor criticizes state epidemiologist Anders Tegnell for his trivialization at the beginning of the pandemic. Tegnell, an official at the health department, put a greater focus on calming the population than taking measures. The forbidden words of the health authority included mouth protection and infections without symptoms, so that SARS-CoV-2 could spread quickly in Sweden and today caused an 11 times higher death rate per million inhabitants than the neighboring country Norway, such as Olsen tells with an insistent voice. These attitudes are well known, but the doctor also addresses a religious level. The health department has assumed the character of sect with a tunnel view, says Björn Olsen. He also complains about group thinking in the Swedish way, which supports the theory of herd immunity. Perhaps an illusion that the term herd also fits behavior in relations to the leadership role of the health authority. Tegnell's statement in the summer story in June that the whole world had gone crazy because they were closing off the public was, according to Olsen, a sign of sectarianism, leaving Sweden as the only globally clear-thinking country. The media would not really report critically on the statements of Tegnell and other experts from the authority, but subordinated themselves as converts to the authority. This was a deadly cocktail for Sweden. Many media and well-known editorialists have ruled out critical questions. The doctor wonders what is taught at the Swedish School of Journalism. In addition, the public health department in Sweden is backed by 65% of the population, and the authorities' peak of trust came over to 70% in April. During this time, the 22 scientists who were also critical of foreign media were most severely attacked on social media and by email. They are traitors, alarmists, Fuscher, hobby epidemiologists, and are looking for research funds. Other doctors said they disgusted them. The question of the right measures against the epidemic split Sweden. The crack went through the review board, but also through families. Now the choir of hate has stopped, since the number of infections has not decreased, a proof that Olsen and the other experts were right from the start. In the country with around 10 million inhabitants, 79,494 cases of infections have been reported. 5,702 people have died to date from COVID-19. Half of the dead are residents of Swedish retirement homes. Jan Hellin, program director of public television SVT, rejected the criticism on last Tuesday. There were also critical voices on the station. However, a lot of space was left to the health department because it acted as the government's official advisor. Stefan Löfven, minister of the Red Greens minority government, had previously followed the agency's recommendations. Tegnell, known and popular for his calming and unspectacular demeanor, continues to be convinced that it is not yet possible to say what was done right or wrong and whether certain measures made a difference. At the presentation of the latest figures on last Tuesday, he was concerned about the current increase in reported infections worldwide, but Sweden is going against the trend, he said. Travel would soon normalize for Sweden, but many countries still keep their borders closed to Sweden, which is not understood by the experts from the health authority, since Sweden is said to have already achieved increased immunity. The capital, even the much discussed herd immunity. Tegnell continues to reject the requirement to introduce a mask for public transport, as Olsen demands as unnecessary. And if you now want to know more about European politics from a German point of view, YouTube has chosen another of my videos right here in the end screen for you, right next to your chance to subscribe to my channel. I'll see you in my next video. Click and enjoy. Viel Spaß!